Hello and welcome to the Days of Learning podcast. I'm your host, David Nelson, and Days of Learning is where we discuss health, wellness, medicine, and community engagement. I am thrilled to have our guest, Dr. Ken Jacobsohn, on the line today to talk about plant-based diet. Welcome, Dr. Jacobsohn.
Thank you for having me.
Oh man, it is a pleasure to have you. And before we begin, I want to thank our sponsors. Days of Learning is sponsored by the Center for Disease Control and Prevention, the Wisconsin Department of Health, Milwaukee County organizations promoting prevention, and of course, our employer, the Medical College of Wisconsin. I want to tell you a little bit about Dr. Jacobsohn before he begins his story, and I'm going to pull up his sketch here. And Dr. Jacobsohn is an associate professor in the Department of Urology at the Medical College of Wisconsin. He is fellowship trained in minimally invasive urologic oncology and board certified in urology. He specializes in robotic and laparoscopic surgery for benign urologic diseases. His goal is to help each patient find the right treatment for their condition and to apply the latest advances in technology when it is possible and appropriate. Whew. I got through that with only one take, Dr. Jacobsohn.
Congratulations.
Thank you. Ken, you know what? We're going to talk about plant-based diet today. But before we do, I want you to tell our listeners about your journey in medicine to this point. And then I want to hear, I know we're going to ask you about some of your stories about how you began in that space, but talk about your journey in medicine to this point.
I think I took a pretty straight line to start. So, left college, entered a 4-year medical school, actually went to the Medical College of Wisconsin. Like most medical students was, pressured into a decision about where I wanted to go, and fairly early on identified that I wanted to go into a surgical subspecialty. I'd had some knowledge about urology from my father, who was a urologist, and found that early on. Proceeded after 4 years of medical school on to residency, which I did down in Houston. Spent 5 years there, and at that time really became interested in robotic surgery, which was then really in its early days. But it was very clear that that's where the big cancer cases were being done through a minimally invasive approach, and that was the stuff that I found most interesting at the time. Went and did a fellowship, as you mentioned, out in California at the City of Hope National Medical Center, probably the best year of my training altogether. And then I returned here to Milwaukee, where I'm from and where I had gone to medical school. Initially went into private practice for about 1.5 years, and then came over to the medical college in 2010.
And I want to ask you, how did your dad influence you?
Well, the influence early on in urology was, I think, just the exposure. I mean, urology is a small field in medicine. That at a school at the time, which was focused very much on training primary care physicians, did not require us to spend any time in. So I knew about it, and I wouldn't have known about it had I not gone to surgeries with him as a sophomore in high school. So early on there was that exposure, but it was never any sort of pressure. It was like, well, here's medicine. I want you to see what medicine looks like. I want you to see what surgery looks like. I want you to know what I do every day. Because as you know, it's hard for anybody to really, family members, friends, to really know what your day looks like unless they walk alongside you. So I think that was the biggest influence, to see that he enjoyed his day, that people around him valued what he was doing and respected him, and that his patients, really trusted him. And I think that was a profound influence early on.
Yeah, I've been married for 35 years and my wife still doesn't know what I do. So
yeah, right. And she probably won't unless she comes along with you.
Well, it's been interesting during this COVID time, working from home with my home office now. She has been here a lot more, so she has a better understanding of all the meetings
Right.
that I go to.
Yeah.
And she doesn't want my job in the first place. You know, I want to talk about that a little bit. We were talking before we went on camera. I said to Dr. Jacobsohn, how are things going? How are things going during the pandemic? I see that you're at the office, which is
Yeah.
which is the hub at the medical college, but how are things going right now in urology and in what you do?
You know, it's definitely not been business as usual. Early on, we shut everything down that wasn't an emergency. So that included basically all elective surgeries like cancer operations that weren't time sensitive. That put us into a big backlog, which we then worked through during May and June when we opened back up the operating rooms. But now, so, you know, the non-cancer aspects of urology, things like kidney stones, prostate enlargement, urinary incontinence, that stuff, people that are symptomatic for is happening to a large degree at a normal volume. But things that require screenings like prostate cancer, getting a PSA, are not happening at the level that they should. And of course, we know the disease hasn't gone away. So things are just getting pushed out. And it's got a lot of us pretty nervous because the longer we wait, the longer the worse disease can get. And so just, you know, men need to get out there and get their annual visits and their screenings. We're doing a lot of things virtually. You know, a lot of it's safe to come to the hospital now. You're probably safer at the hospital than just about anybody anywhere else in the city. So encourage people to go out and get those screenings and get those visits done that they need to do to take care of their own health.
Right on. So you're encouraging people, especially men at a particular age, to get that prostate that screening. What is that age that you recommend that all of this happen for men?
Yeah, so there are a few different recommendations out there for men of average risk. So that would be, you know, no family history, no first degree relative, father, brother, uncle with prostate cancer, and non-African American men. That would be a screening PSA at 55. Some places recommend 50. If you've got any of those risk factors, potentially West African heritage, a first degree relative, we should really be thinking about getting a PSA or at least talking to your doctor about it at age 40.
Right on. Good to know. What are you seeing in your patients these days, Ken? What kind of profile are we looking at for patients?
So, you know, the average, I see about 75% men, and that's just because I see a lot of prostate cancer. It's a little bit less in urology overall. But we see predominantly middle-aged folks, and they've got all the chronic Western illnesses that are so prevalent in this country. Heart disease, high blood pressure, high cholesterol, diabetes, obesity, and all the consequences that go along with that, including some urologic disease, which is why they come, you know, to see a specialist or subspecialist. But the burden of disease is quite high. We are not a healthy population.
So how does that idea of those Western issues, how does that play out in prostate cancer as well as people who might develop that?
Yeah, so prostate cancer is really a very interesting story in terms of lifestyle medicine. So lifestyle medicine is a subspecialty or is a board certification which you can obtain that focuses on the evidence-based lifestyle modifications or lifestyle behaviors which lead to health. So we actually know what makes people healthy. It's eating a healthy diet, It's getting enough sleep, moving our body regularly, managing stress, being connected to our community, and avoiding risky behaviors like tobacco. And we actually know that if we maximize those things in terms of prostate cancer risk, we can put ourselves in extremely low risk groups. So for example, we know that there are foods implicated in risk of prostate cancer. Specifically, dairy is the worst of them all, omnipresent in the standard American diet. Populations that don't consume dairy ever have the lowest rates of prostate cancer. Isn't that amazing? Yet that's not on the label. So we really can modify our risk overall. And then we also know that if we take men who've developed prostate cancer, so they've crested that hill, but perhaps it's not that bad, it's a low risk prostate cancer, that we can, if we encourage them to modify their lifestyle, so adopt a whole foods plant-based diet, exercise regularly, do some yoga or meditation, that their cancer actually slows down without any pharmaceuticals, without any surgical or radiation intervention. We can actually keep them and their prostate together in a safe way for a very long time. And it's amazing when I talk to patients about this, how many of them are excited about it and would much rather go that direction than have some kind of intervention.
You know, I want to get there. But before we do, I want to ask you, Ken, because I've been in this field for a long time, in the prevention field. And we often talk about your lifestyle modification for heart health, or we talk about lifestyle modification for decreasing obesity, which has a number of factors that associated with that diseases. How come we never hear about this in the popular mainstream about prostate health for men around these lifestyle modifications? For example, sleep, because there still is the myth that, you know, the tougher you are, the less sleep you need. And you're saying the opposite there.
Right. Yeah. Oh, very complicated problem, right? So number one, I think, has to do with culture. So we've got a culture that prioritizes things that make money. There's no money in health. There's also no money in death. There's only money in disease. As much as it might sound cynical, it's true. So where do we make money in the health? Not we, but where do people make money in the health game? It's in supplements, it's in pharmaceuticals, it's in procedures, it's in snake oil. It's not in selling broccoli or getting enough sleep. Unfortunately, what's happened in terms of medical schools and medical training is that we've prioritized the things that make money, and that's pharmaceuticals and procedures. And I was right step by step with all of that training, somewhat unknowingly, right? Because I didn't ask the right questions initially. But we don't hear about it in terms of prostate because of money, and because people have largely not had a lot of success in getting lifestyle modification and other diseases, right? And that happens because the prescription isn't done right. So when that guy with heart disease comes into his cardiologist's office, chances are he's saying, oh, by the way, you should eat right and make sure you exercise more. That's not a tangible target for him or her. But instead, if I say something like, you need to get 2.5 hours of moderate to vigorous exercise every week, and I'm going to sit down and make a schedule for you to have that happen. Let's figure out where the challenges are in terms of you getting there. And I want you to come back in a week with a chart that shows me where you got it. Now I've got a prescription I can go with, a prescription that's just as good as a Tylenol or a Motrin. And so we haven't seen that skill level pushed in medical students or in residents or in faculty physicians, and we haven't seen it trickle down certainly into urology either.
Why not?
I think it's an education piece, number one. I think that it's people see it as a challenge, right? So it takes time. It takes time in the day to sit down with somebody a patient who's used to a fast food answer. I want the quick fix. And
Sure.
what's the pill? My buddy got the pill and his blood pressure's fine and he can keep eating bacon. So I want the pill so I can keep eating bacon. And so the physician who's in an economic system which pushes them to get through a certain number of patients in a certain amount of time is going to prioritize that pill which the patient wants and makes them happy and gets the better patient satisfaction score, than to take the extra 10 minutes to explain why treating root cause of disease, which is lifestyle and diet predominantly, is the better way. Because if we don't, so there's a lot of factors, but it primarily comes down to money and training.
So maybe maybe we can have some cynicism here, and I'm good with cynicism. I'm as cynical as they come at times, but as also we should consider being critical of the system that prioritizes the pill and prioritizes seeing more patients in less time. Yep. And I get it that this is a business at the heart of it, but we're talking about the lives of our patients, and I would also add with the people that I work with that are maybe working 8, 10, 12, 14 hours a day, and they don't get a lunch break, they don't get paid time off, and they're doing their best to keep the family intact, keep the door locked, and keep everybody fed. So it's simple, but it's harder for those where the disparities are the greatest.
Oh, without a doubt. So, that the explanation I was leaning on is why don't we get that pushed from the provider standpoint? And just the same, right? If I see a patient who's overwhelmed in their life, to ask them to make modifications may seem impossible.
Right.
And so from that standpoint, we have to meet people where they are to some degree, right? Expecting that everybody's going to just be able to go from one extreme to the other in a matter of days is not realistic. But if we have a community of health, if we set people up in ways that they can be successful, then we have opportunity, and every little bit of change makes a difference. So, if I eat 21 meals a week of unhealthy food, and I can switch that to 14 meals a week of unhealthy food and 7 meals a week of healthy food, I'm going to be a third healthier than I was a week later.
Yeah, I hear you here. And this is where we need to think about it. We get into a structure that says it's either extreme or nothing at all. But you said something really important, Ken, this idea of success, setting people up, and I will add, and supporting them, giving that prescription to say, I have many of people that say, I want to start to exercise, but I don't know how. It's easy for you and I to do it in a position of privilege to say, well, everybody knows how to exercise. No, they don't. Everybody knows how to eat healthy. No, they don't. So they need those basic instructions. We're actually going to be having a series of shows called Back to the Kitchen, where we literally teach people how to cook again. You and I are both old enough to know that the microwave oven did nothing to help set people up for success. Would you agree?
Oh, yeah. Oh, for sure. Right. But, it heated the popcorn pretty quick.
Ken, talk a little bit, not a little bit, I want to talk about your journey in plant-based diet. Tell our listeners how you began, and tell us how you began in this space.
So, I think I was like everybody else, head in the sand, thinking I was eating a good, healthy diet. And then I witnessed something which was totally unexpected, and that was my father, who I mentioned earlier, had been diabetic for 6 years, on metformin all that time, didn't really tolerate it very well, was having okay success, but not great. He certainly wasn't curing his disease. He was just managing it. And one day he was seeing a physical therapist for a shoulder injury. And that physical therapist suggested he pick up a book called The End of Diabetes by Joel Fuhrman. And this book focuses on eating a whole food plant-based diet that's naturally low in fat to actually reverse insulin resistance. And he was desperate for anything different and gave it a shot. Within a matter of months, lost 35 pounds, improved his insulin resistance to the point of getting off of his medication. And I said, hey, I think I missed something in medical school, because that's not happening around me. It's certainly not happening to my patients, and I don't recall that lecture. So my wife and I started looking at everything we could look at, every documentary that was out there on food. I read a bunch of articles, and we started making changes in our own life. First, we cut out processed sugar, and eventually cut out all animal products and pretty much processed sugar overall. And within a matter of days, my daughter was feeling better, no longer having abdominal cramping. My wife was feeling better. I was losing weight. I didn't feel like I needed my morning cup of coffee anymore. I had more energy. I lost 20 pounds. My cholesterol came down 60 points. Only by changing what was on the plate. I didn't change anything else. And the food was amazing. And so I saw that journey in my own family, and I said, my patients need to know about this. And so I went and got some more training, so that I might actually be able to speak from a position of knowledge and maybe a little bit of credibility. And I started to share that message, and I didn't do a terribly good job at first. I think I had some home runs, some people who, I would describe their change as low-hanging fruit. You just like, oh, by the way, you should eat healthy food. And they did. And all of a sudden they lost 30 pounds and felt great, and their blood pressure got better. And then I had other people who were just terribly offended, because I didn't know how to meet them where they were. I didn't know how to help them be successful. And we've got a lot of people who hold strong to their lifestyle and beliefs, right? I need my bacon and eggs in the morning. That's what makes me feel like me.
So I want to back up a little bit, because you used a term that not all the listeners will be familiar with. You said your dad was on this drug called metformin. What is that?
Yeah, metformin is a drug which helps improve insulin sensitivity, right? So the insulin is a hormone secreted by the pancreas that encourages our muscle and liver cells to pull sugar out of the bloodstream. And we become resistant to insulin when we have too much fat stored up in our bodies. And that's called insulin resistance. And so when we are insulin resistant to insulin, our blood sugar is high because we don't respond appropriately to that signal. So metformin is a medication which helps improve our sensitivity to insulin. And this is a common drug. We see it out there in a lot of patients. And the standard approach to diabetes is to eat a diet which is naturally low in sugar. So that if I eat a low sugar diet or low sugar foods, my blood sugar is low all the time. But if I don't reduce my overall fat stores, I don't actually improve my insulin sensitivity. So the moment I eat that piece of fruit, my blood sugar goes through the roof, and I say, well, fruit's the problem. But the reality is, this is a root cause approach, which is what my dad took, and that is to reduce his overall total body fat. And the body responds by improving our sensitivity to insulin, and then you can come off of that medication, and he can eat all the fruit he wants.
So what was your dad's initial response as a scientist to this physical therapist who was taking care of his shoulder, I believe. Was that
Yeah,
right?
right.
What was his response to this guy?
You know, I think it was somebody he'd had some trust with, because he'd been going to him for a matter of a couple months, and they'd built up a rapport. And that particular physical therapist had some training in nutrition, so it was somebody that he respected. But I think, you know, he picked up this book, he read it cover to cover. He was skeptical, as all scientists are, but also the data is what it is. And so most good scientists will follow the data, and it was there.
And so your dad started this journey.
Yeah.
And how did his shoulder do? Did it get better?
His shoulder is better, yes.
Right on. He changed his diet.
Mm-hmm.
He got off the metformin.
Yeah.
And how young is your dad?
My dad is 78.
Right on.
Yeah. So started that process at about 70, 71, 72, right? So, you know, most of my patients would say I'm too old to change at that point. But the reality is you aren't. And in fact, we see older patients who adopt healthy lifestyle behaviors like healthy diets see almost more improvement than do younger patients who haven't accumulated as many chronic Western illnesses.
So you and your wife decided to do this. And you said something that I want to drill down on. You said you started with taking out processed sugar.
Yeah.
Tell me what that is.
Yeah. So we hear this a lot of in the press, and people talk about carbohydrates. So sugars are carbohydrates. There's basically we could think of two kinds of carbohydrate. There's complex carbohydrates, and I would refer to these as unprocessed foods. Okay, so that's the fruit, that's the sugar in fruit that comes along with fiber. That's the sugar in corn that comes along with all the nutrients and vitamins and minerals in corn. And then there's processed sugar, which is when we strip the sugar away from the plant. So high fructose corn syrup. Table sugar, the sugar you might put in your coffee. These are simple processed sugars. And the difference is that simple processed sugars are absorbed very quickly by the body. They cause a spike in our blood sugar. They make us feel good. And then we crash because we metabolize it very quickly. Unprocessed sugars cause a much slower rise in our blood sugar and a much more sustained feeling of fullness because they aren't absorbed so quickly because the body's spending time digesting the vitamins, the fiber, the phytochemicals that come along with that unprocessed carbohydrate. So it's a big distinction. So what we started to do was to say, well, if there are processed sugars in this food, and you can know it very easily because number one, that food's got a package and a label. So unprocessed foods, you can look at it and recognize what it is right away, like an apple or a bean or a whole grain. So the example I like to give is my breakfast was typically a cup of coffee, some Greek yogurt with some granola and a banana. Okay. Now, there's a recommendation that an adult male, U.S. adult male, should eat no more than 38 grams of sugar a day. So when I got into this knowledge, which I never had before, I never even looked at a label, quite frankly. I just thought Greek yogurt was a good choice. So I'm looking at the side of this Greek yogurt and the granola that I put in it, and I realized I'm having 19 grams of processed sugar before I leave the house in the morning. So half of my daily sugar before I even leave. And I'm eating that at 6 o'clock in the morning, and by 9:30, I'm starving. Because all I've done is eat food that isn't sustainable, that has no fiber. And so I got rid of that. I just stopped eating it. And I was fine. In fact, I had better energy all morning long. I didn't even need to eat until noon if I didn't want to. And that journey left me feeling stronger and lighter and better. And I had no idea. I thought I was making a good choice.
You know, it's interesting as you say that, because I know that your work is strenuous in that when you're seeing patients and on your feet and in the operating room, you're on the go, right?
Sure. Yeah.
And that feeling of being hunger, I can imagine that might be distracting at times when you're trying to focus on the patient.
You know, we don't need to eat nearly as much as is advertised. Look around. How much obesity is there, right? And where everybody's being told you got to have 3 meals and 2 snacks a day. We are an overfed society. So when it came down to it, eating breakfast at all, for the most part, was something I was doing because I feared I was going to be hungry. Or because I was told breakfast is the most important meal of the day. Well, I'm going to be starting surgery. I got to leave the house at 6. I'm going to be starting surgery about 7:30. I might be hungry by 7:45, so I better eat before I go because, or I better eat before I get on this plane because, you know, it's an hour and a half flight. What if I'm hungry mid-air? So, and that's much of convention of when and what people eat. It's because we think we have to. And the reality is that that's a societal, that's a societal norm, which has nothing to do with human biology or when we're really hungry. So if I miss a meal, I'll be fine.
Yeah, and it's also the way that companies market to food to us as well.
Yeah.
Now, I can imagine that, because I frankly don't read labels. I can imagine sugars in a lot of food that's processed.
Oh, almost everything, right? So if we're going to get, you know, the ingredient labels are mind-blowing, right? I mean, we really want to focus on foods that don't have labels, or that only have you know 4 or 5 ingredients, things that we can recognize. But yeah, processed sugars and everything. And now actually there is a new, it's about 2 years old, modification to food labels that now have to specifically say how many grams of added sugar are there. And so you can find that at the bottom.
What's the difference?
Well, added sugars would just be straight, simple sugars, right?
Okay.
So if I've, say, got something like a Lara bar, which is made of dates,
Sure.
I would have no added sugars because I just pressed a date in there. Whereas if I took a candy bar that's just got straight high fructose corn syrup, that's all added sugar.
So many of the things that people have thought that were healthy, like the Greek yogurt, which is marketed pretty heavily, actually have a great deal of added processed sugar to them.
You're right on the money. Marketing is king.
Tell us how you have felt, since I want to go with you, this case study of one, how you and your wife have felt of switching over to this plant-based diet and omitting the processed sugar. What has it meant to you?
Well, from a health standpoint, it's been a huge change. You know, we look at it in terms of lifestyle, right? These aren't, it's not a fad for us. It's opened up so much that I never appreciated before in terms of being of service to people around me, in terms of an understanding of food systems, in terms of understanding the ethical implications of consuming animal products and the environmental implications of producing animal products, which has left us to some degree feeling very much a part of a small community, and being an island that way, particularly in this part of the world. There aren't that many people that choose to live the way that we do. But also being very enthusiastic about being a part of that culture.
So when you're talking with your patients, where do you begin?
The first thing is understanding somebody's why. Okay, so why are you here? I mean, that's something I didn't used to ask. I used to just say, well, what's the disease and what's the treatment? But I've come to change and say, why is this person in front of me now? And we don't always know, but many times we do know. And then I think about why would they change? Or try to talk to them about why they might change. What's motivating for them? Do they want to make it to their kids' graduation? Do they want to live to be 105? Are they tired of being on these medications? Are they worried about going on dialysis? What might it be that's going to motivate this person? Because I see a lot of people who are in the 7th decade of life or older. They're understanding that they are starting to see some decline, that their medication requirements are going up. And they can look around and see that their friends, neighbors, relatives are not healthy. And so when you start to lift that veil a little bit, most people go, yeah, I see that. We're not healthy. And so they will then, I can quickly draw them to realize that consequences have, or choices have results. So if you're happy with the results that you've been getting, keep doing what you're doing. But if you want something different, there's a different, better way, and that is to make different choices. And it's very empowering to people. It's very empowering to not just sit back and be at the whim of lobbyists and government subsidies and special interests, but to take charge of their own health by eating right, by exercising, by focusing on their own well-being. And the response is tremendous in people who start to make the moves.
It's that idea of empowerment when you start with the why and then asking people what they want to have a difference. Because you probably get some people that are coming to see you that might be pretty healthy, but maybe they're making some small, some subtle shifts in their diet. Maybe they do some diet, maybe they're doing activity already, but they're not changing their diet. Where do you begin when people want to see something different, whether it be large changes or small changes? What do you say to people?
Well, so it starts with some education, right? So we've got to understand, where are they not maximizing their behaviors? So 80% of it's diet. I'm yet to run into a person with a perfect diet. Maybe that's selected, right? These are the people who are coming to see me. They've already got disease, right? But it's just not in our culture. So we've got to point them in to some resources to help understand that health is the interaction of environment and genetics. And then it's about writing that prescription. So often I will challenge people. I'll tell them, take a week, think about what it is that you already like that's on, my approved list of foods. Or what could you modify? Could you have a stir fry without the chicken? Could you make chili without the meat? Could you have a fruit smoothie in the morning? And then challenge them to 1 month. Can you do it? Best of your ability, all in 1 month. And then give them the tools. So I want you to go shopping before that start date. I want you to get the right foods around. And then I want you to remove the temptation. I want you literally to give away that food, lock up that food, stick it in the freezer, whatever you need to do, because temptation is really hard at home, right? So when you're hungry and the food isn't available, about that box of cookies that's in the back of the pantry, or about the ice cream that's in the freezer. But if it's not there, and you've got a bunch of fruit or carrots or whatever it may be that's cut up and ready to go, of course you can be successful. And so I remind people about what's the consequence of continuing on the path that you've been on. Well, your blood pressure is going to get worse. Your prostate cancer might get worse. You're going to need more medications. You're going to, set yourself up for cancer, heart disease, diabetes, death from any of those in a premature, unpleasant fashion. So do you want to look back 3 years from now when you have that heart attack and say, I wish I would have tried it? Or do you want to go and say, well, I tried it and it didn't work for me, but at least you gave it a shot. And almost everybody that goes down that road of saying, well, I'm going to give it a shot, they may not come to 100% perfect whole food plant-based diet in the end, but they're going to be a heck of a lot closer than they started, and they're going to feel better. And people like that opportunity.
You gave us a lot to unpack there, and I want to unpack a little bit of this. You mentioned approved foods. Can you tell us some of these approved foods that are on this idea of a plant-based diet? And I got to say, as you were talking about, yeah, I eat stir fry. I could eat without the chicken. Yeah, I like chili. I could have it without the meat. Yeah, I could do some of that. And frankly, I don't, because I would be in that I am part of that. I do okay, but it's far from perfect. But I like those examples. But what are some of these foods that you talk about?
Yeah, so let's just back up a step further and say, why not animal products, right? So what's wrong with the chicken? What's wrong with the ground beef? Well, from a health standpoint, we get 3 things when we eat animal products. We get saturated fat, we get cholesterol, and we get protein. Now, we've got, overwhelming evidence consuming saturated fat leads to coronary artery disease and heart disease. We've got American Heart Association presidential advisory that says we should limit our saturated fat consumption as much as possible, less than 5% of our diet. It's basically impossible to get less than 5% saturated fat consumption by eating animal products. Nobody needs dietary cholesterol. We get enough cholesterol from plant foods. We don't need extra cholesterol by any means. And you can get all the protein you need from plants, just like the world's largest animals, right? An elephant doesn't eat meat. Gorilla barely eats any sort of meat. And these animals don't go to the gym. They're strong. They're healthy animals. So we don't need animal protein. So there's 300,000 edible plants. Now, you might go to the average grocery store and see roughly 200 different varieties, but there's 300,000 edible plants across the planet. Huge number. So we don't have to eat things that we don't want. But the key is that we're focusing on whole foods. So this, again, is the minimally processed food. That's the corn, not the corn syrup, the olive, not the olive oil, though olive oil is probably not the worst. But these are whole plants that we can recognize. Now, the difference there is if you go to the store and it's got a label that says plant-based, chances are it's a processed food. So there's lots of junk food out there. The potato, not the potato chip. Whole grain breads are fine. Whole grain pastas are fine. Oatmeal's fine. Oat, of course, being a whole grain. Things like soy and tofu are just fine. So, a lot of times I'll hear people say, well, I like the chicken in my stir fry, right? Chicken has no flavor. If I just gave you some boiled chicken, you'd say this is disgusting. The meat is just a means to hold the spices and seasonings. So you would not miss out one bit if you left that chicken out of the stir fry and you added more vegetables and maybe some tofu if you weren't scared of it. And then there's no reason to be scared. Tofu is perfectly healthy. It's just sort of an intimidating product if you've never dealt with it before. So, lots of Mexican-inspired foods, lots of tacos. You can have a pizza. A lot of the food doesn't really look different or taste different than you started. It's just skipping the processed component and sticking with healthier ingredients.
So you had mentioned 300,000 edible plants, which is just an amazing number, and our grocery store may have only 200. If someone wants to make this change, can they still go to their local grocery store, or do they have to go to some specialty stores?
No. Oh, great question. Great question. Eating the way I eat and I recommend to eat is not expensive. Okay, so you do not have to eat organic produce. There are reasons to eat organic produce, but you don't have to. We're talking about simple things, rice and beans. Okay, every grocery store I've ever been to in any part of the world has a bag of rice and a bag of beans. As cheap as they come, really. You know, carrots, lettuce, tomatoes, just we're talking about basic ingredients. Now, of course, we've got areas that are food deserts. We've got people who eat out of convenience stores. That is a huge challenge. That is a huge challenge. But for the average person, any grocery store is going to have something that will be just fine. The specialty grocery stores may have wider varieties of food. They may have larger sections of organic produce. I eat mostly organic produce. I'm privileged to be able to do that. The reason I eat organic produce is better for the environment. It isn't necessarily healthier for me, but it's better for the planet overall. And so I choose to make that choice when I have it available. But any grocery store will do.
That's a good point. And this idea of rice and beans not only being it's not only, as you said, good for you, but it's also affordable. And the same thing with oatmeal. Oatmeal, I think, is relatively inexpensive when you make it. And you mentioned other things. You also mentioned, Ken, I want to have you talk about this. You also mentioned getting rid of some things. Are there things that are high on your list that you go, man, if Americans only took this, and this out, we would be so much better for it? Is there anything on your list that you go, and you know what, we're not into name brands, but if there's something that needs to be named in this space, I'd be curious your thoughts on this.
Yeah. Well, so what is the American diet? It's about 63% processed foods. It's 35% animal products, and it's about 10% plants, and half of those plants are French fries. Okay, so what can we get rid of that encompasses all of those things? Well, you know, the focus is on whole foods. I actually think, and this is the part where I probably get kicked out of Wisconsin, I actually think dairy is like one of the worst things we could possibly be consuming. It's our number one source of saturated fat in terms of cheese pizza. You know, and why isn't dairy a health food? Well, dairy essentially is growth formula for a cow. It's intended to grow a baby calf from newborn to full-size cow in a matter of 12 months. So when we give it to adults of another species, with all the growth hormones, with all the saturated fat, bad things happen. We get a lot of disease. But we've had a marketing campaign that milk does a body good. We've had government subsidies dating back many years. We have farmers whose livelihoods are on the line. There's no question about that. But it's not a health food. So I'd love to get rid of that. And I'd love to get rid of chicken. Chicken's not a health food. It's every bit as bad for your heart. These chicken farms where we raise 50,000 chickens in a barn are just breeding grounds for pandemics. It's tremendously abusive to the animals. It's tremendously abusive to the workers who work there. It's just it's hard to believe that we live on a planet that still farms animals that way.
What I think I hear you saying here, and I don't think we have to worry about this show putting farmers out of business.
No, they might just send hate. They might send hate mail, though.
You know what? You know, we're willing to have discourse in this space. I said at the beginning, Days of Learning is about discussion.
Yeah.
But I think what I hear you saying, Ken, is that we all need to make some shift in how we view food. Because frankly, I don't just eat food when I'm hungry.
Sure.
Let's be clear here. I eat food because I'm bored. I eat food because I'm angry, or before as I'm sad, and whatever.
Yeah, absolutely.
Well, I think what I hear you saying is when we're going to meet people where they are, that if you have this 21 meals in a week or less or more, that you should be giving some thought about what you put into those meals. And so you can still eat, you choose not to eat chicken, and that's cool. But somebody could say, well, I like chicken, but I don't need to eat it 6 times a week. I could say, let me cut that down to a couple and do something different. Is that what I hear you saying here?
So any movement away from where you started. Look, I was there. I was eating animal products 21 meals out of 21 meals a week. So I get it. I understand. I made all those decisions. A lot of that was processed food. I wasn't, and I was eating because it was, like I said, 6 a.m., or I was eating because it was culturally appropriate to do so, not because I was hungry. I wasn't looking at food as fuel or food as health. We have a great example of the blue zones. So the blue zones are 5 places in the world where we have historical populations with longevity. Greatest numbers of people living into their late 90s or hundreds in a healthy way. And National Geographic and Buettner have studied these places and said, what is it that they're doing to get that longevity? And food is a huge component of it. It's not the only thing. But all those populations eat a 95% or higher whole foods plant-based diet. It's not complicated food. It's rice and beans. It's sweet potatoes. It's lentils. It's whole grains. It isn't the 5% of my diet that's going to determine my health. It's the 90% of my diet. So if you still want to keep that chicken in there because that makes you feel better, fine. And then you have to look at the results. So if 60% of my meals include animal products, but I'm still on 2 medications for my high blood pressure, am I content taking two blood pressure medications so that I can eat chicken? Maybe I am. Maybe I never looked at it that way. Maybe I never said I'm taking these medications because of what I'm ingesting, or because I'm not moving enough, or because I don't engage in meditation, or because I've got too much stress and I'm not managing that the way I need to. And if I change my thought process and say, well, if I look at food as medicine, if I look at the opportunity of every time I open my mouth as a chance to be healthier, then maybe I do make a different choice. Maybe I do make a different choice. And instead of eating for my taste buds, I'm eating for my health. And what happens is our taste buds will shift. In a matter of 3 to 5 days, it's not that you immediately will lose the craving for the chicken, but it doesn't take very long. So what determines our cravings is what's called our gut microbiome. So these are the bacteria that live in our gut. We have more bacteria in our gut by a long shot than we have human cells in our body. And they determine our ability to digest food. They determine our cravings, our tastes, our immune system, our health, our disease. And so what's there is there based upon what we eat. We fuel them with the food that we consume. Which is why if you eat something that perhaps you never ate before, it might not agree with you because you don't have the bacteria that you need in order to digest that food. But slowly but surely you will be able to handle it, and you'll be healthier on the other end. And so your cravings change. Like I said, I was eating animal products 21 meals a week. I don't even look at and that was all of it, right? I was eating burgers and chicken and Friday night fish fry and all the stuff that people eat around here. I have no appetite for it anymore. And that just was a surprise to me. Just doesn't even appeal. So if I can get people to be open to the change and follow it wherever it may lead, they may, you don't know where they'll end up. So if I set it and say, well, I can only give up 60% or 40%, I have to continue at 60%. Awesome. Way better than where you started. I love it. Yeah, but you may end up somewhere else.
I want to also bring back, because I know you well enough, and it's important for us to do this for the listeners. What Dr. Jacobsohn is saying here is, and he started off this by talking about lifestyle modifications. And he also mentioned the idea of diet, which we've been talking about, this idea of sleep and stress, tobacco, and getting your weight under control, and doing other things in order to have a more fulfilling life. So diet is only one component of it, because you could be filled with stress and not getting enough sleep and have a plant-based diet and have disease. Is that correct?
If you pick one, pick any one of those things and make it the worst it possibly can be, and it doesn't trump everything else, right? So if we eat if you eat the perfect diet and you get 8 hours of sleep and you live in a pressure cooker and all you do is have stress all day long, you're going to have disease, or at least you're set up for it. So yeah, we have to focus on all of these things to be healthy, and what any given one person may need may be different than somebody else. And so that's where it's an individualized approach, even though what works for one person, the answers are the same. It's how we get there that's different.
Yes, and I want to say all to all our listeners, and Ken is saying this as well, as keep track of what you do and how your body responds, one, but also what you do with your body. So if you are aiming for a certain amount of sleep every night, see how you do. If you're making a change in your diet, understand what you eat, understand what you can change, and understand what you enjoy. And because you're not saying not to enjoy life or to enjoy food, because food comes in many forms and many features, and it's used for many reasons. So I don't think you're saying, and I think it's important for us to recognize that you're not just saying change everything, throw out what you're doing, but be open to what may benefit your body.
I agree, absolutely. So most of the people who eat the way I eat, whole food, plant-based diet, would consider themselves foodies. So if you love food, you will love food. It's just a matter of what that food is. Okay, so, but we have to be open to a different way. And that perhaps much of what we think we are doing is right, is based upon somebody else's interest, somebody else's marketing, somebody else's profit off of our lives.
I want to ask you this question then, Ken. My world is community. Your world is medicine. How does community and medicine and this idea of plant-based diet and health fit together? How can it fit together? What would be your vision for this?
Well, the big vision is that people come to the hospital to be healthy, not just to treat disease, right? So we should be viewing our big institutions as places of health, where we enable people to live their best lives instead of just putting a Band-Aid on the symptoms or side effects of the current disease. And so that means engaging people in the community before they need to come in with their heart attack, or helping them on their way out from their heart attack so that they don't come back with another one. There's a big education gap. There's an education gap in my colleagues. There's an education gap in the community. What I've found with my patients is that people want health. I mean, ultimately, you often hear people say, well, so-and-so may not have a lot of money, but she's got her health and her family, so that's what's most important. And it is. It is. Health in our community is most important, far more important than dollars. But people don't know how to be there. Most doctors don't know how to make patients healthy. We know how to treat disease. There's a difference. So we need to educate our colleagues, but we need to educate the community as well. And we need structural changes that make it easy for people to be healthy. So right now, if you're at this hospital that I work at, you can get bacon and eggs in your room. If you're in prison, what kind of food is being served there? If you're at a school getting the free lunch, are we serving you fruits and vegetables, or are you getting the processed food out of the package because it has shelf life and because kids like it? So these are just all sorts of small but extremely important ways, because if we learn early on that eating the Twinkie, satisfies for 5 minutes, when we're older and have money, that's what we eat too.
I appreciate what you're saying here, because you're not just saying, hey, community, you need to change because we know best for you. You said also that your brothers and sisters in the field of medicine, and I'm going to actually put this in, I would assume you're also meaning how we train medical students and that next generation of workforce, that they need to change as well. So it's a shifting not only of the community, but of the attitude from a sickness-based model to one of health and well-being, so that they both need to change in order to shift the social view of how we view food and how we view health as well.
Yeah, so I would even go so far as to say we don't know what makes people healthy. I mean, there's a few of us who have an idea, but most physicians don't. That's just not part of the training. Well, the average physician spends like 2 to 4 hours in medical school on nutrition. 2 to 4 hours. It's nothing. But our patients view us as experts on what is healthy, right? So if I come into my doctor and I say, hey, doc, I got high blood pressure. What should I be eating? And the doctor just says, well, everything in moderation, don't overdo it, which is such a common thing to say. That the patient's going to walk out of there and say, well, my doctor said it's okay to have bacon every once in a while. It's fine.
I only
whatever.
have it 6 times a week.
Yeah, that's right. So, well, I did it once. So, bacon the next morning is fine too. Just got to make sure I put salt on my eggs. So we're condoning that behavior, even if we aren't intentionally doing so. That's a problem. That's a huge problem. So we need to change that educational model to the very beginning. And the reality is that, we've got this huge problem of physician burnout or moral injury or whatever you want to call it, because we don't actually make a lot of people healthier. And it's not terribly satisfying. No, that's not the only reason. It's a very complex situation. And this is one of the things that I think I saw in my practice when the light was finally lifted. Somebody comes to me with prostate cancer, and if I cure that prostate cancer, best case scenario, person's as good as they were the day before their diagnosis when I'm done. Now, I get you eating healthy food and exercising and lowering your blood pressure and feeling better. All of a sudden, you're a healthy person. And those are the happiest patients I've ever had. And the most satisfied patients I've ever had. And so that's a entirely different financial structure than we've got in medicine right now, is to incentivize that time being spent with people. But it needs to be done. It has to be done because we're on a path which is unsustainable.
So I want to ask you this. Let's say some people make huge changes. Some people make no changes. Excuse me. But the majority of the people make, let's say they go halfway. They're getting some exercise. They're eating more plant-based diet. They're cutting out processed sugar. What does your profile of the patients look like then?
It's interesting because I actually think, so it can be hard to be in that position and sustain it, to be halfway, because your diet's still half bad. It might be half good and you might be better than you were, but your diet's still half bad. So you haven't really changed your gut microbiome the way you need to. You aren't feeling amazing or as amazing as you could be. So maybe you lost 10 pounds, but you really needed to lose 15 or 20 to get off the medication. And lifestyle changes ultimately have to feel good to be sustainable. Fear is not a good motivator in the long run. It's a good motivator in the short term, like, oh, geez, I better step back because I'm going to fall off this building. But if I've been standing on the edge of the building for an hour, I realize I'm not going to fall off, so I might not back up. But if, like, you know, my erections start to work again and I've got more energy all day long, I'm going to be pretty motivated to keep eating the good food. So that's a population that I see frequently. I've made some changes. You know, we're not doing as good as you want, Doc, but we're doing pretty good. Well, that's people that we have to support. So
Yes.
What do you need from me to get from A to B? Do you need more recipes? Man, I got a million recipes. Do you need to connect with other people? I mean, this is where cultural change makes a huge difference, right? If you're back when we could, if we were going to a picnic or we're going to a big event and there's lots of healthy food, only healthy food to choose from, of course, we would all eat healthy food. We've been in, you know, it's easy to do. So we have to support those people, again, thinking about their motivation. Why is it that you might go from 60% to 90%? What is it that you're looking for? Do we need to figure out a way to get you 10 more minutes of walking a day? Do we need to convince you that watching that last episode of reality TV in place of an extra 30 minutes of sleep is not worth your time? Whatever it may be, empower patients, understand what it is that is holding them back. Is it that the spouse refuses to make changes and so all you have is what, temptation around the house? How do we get the spouse educated? How do we get them involved? Who else eats with you? Where do you get your food? Who makes your food? So it's a complicated scenario, but I really encourage people. I mean, if you've made it that far, it's a long way. You've already figured out a whole bunch of food that you can make and that you can eat and that you like. So it's just a matter of understanding, helping them understand that getting a little bit further may benefit them.
Really like the way you said that, and you started off by saying, in my note here is, what do you need from me? So it comes back to the idea of providing people the support they need to be successful.
Yeah, right. So it's our job to help people be healthy, not just to treat their disease.
So Doc, where are you going to take this? What comes next for you in this space?
Well, we're rowing upstream most of the time. I'm sure you felt that way at times yourself. I'm working very hard to, we had been working very hard to get a boot camp up and running. It's been derailed a little bit by the pandemic because our boot camp format included, 15 to 20 people in a room, meeting over 3 weeks. And of course, we can't put that many people in a room together at the moment. We're working hard at getting a lifestyle medicine clinic up and going, and there are some optimistic signs that will happen. And there are a lot of different aspects of that. So not just getting the message to our patients, but a forward-facing educational platform for healthcare providers. We want to engage the community. I'm from Milwaukee. I view this as my home and my people, and I want the city to be healthy. So that's a key component, that we're accessible to everybody who needs it, regardless of their social determinants. And I'm optimistic that happens. And until then, I'm continuing to work one patient at a time in order to make the people I have opportunity to reach healthier.
Well, I hope that we reach a few people with this show, but how do people get a hold of you if they want to have a consultation with you?
Yeah, the simplest thing is just the main 1-800-doctors line. They can call there, in urology, easy to get in touch. You can find me on Twitter, that's out there as well.
Right on.
Jacobsohn. Yeah.
And we'll put some of that, we'll make some connections there. I enjoy talking about this with you. I know that I'm going to, I'm now motivated again to think about this. It's saying, where do I need support? And I know needing to eat more plant-based diet. And the more I like it, the more I try it, the more I'll like it. I'm still, you're going to have to convince me on the tofu.
Maybe. I will make you some tofu. It's I will say that was, I'd never eaten tofu before we started making these changes myself. And the first time we tried it, I was like, We didn't do it right. But our kids love it now that we figured it out, and it's crispy and it's tasty and it's filling. It's a great option.
So I do want to ask you, so people like their dessert, they like their ice cream, and you said something about smoothies.
Yeah,
How do you do a smoothie without dairy then?
sure. Super easy. So the way I make a smoothie, we'll take bananas when they start to get some brown spots and chop them into little pieces, stick them in a bag, and put it in the freezer. Okay, so frozen banana is the base. So you can do it from a fresh banana too, but that gives you some creaminess to it.
Mm-hmm.
I like a green smoothie. I'll throw in a ton of spinach in there. I'll put some mixed berries. You can add things like hemp seed, flax seed, chia seed, whatever you want. A little peanut butter if you prefer that. High-speed blender and go. And it's packed with nutrients. It's creamy. It's filling. It's amazing. If you want it a little sweeter, put 2 dates in it. And there's a million variations. But it's not hard. It's not hard. No dairy. I'll make you one.
I love it. Tofu and a smoothie. I like this. I think we're going to I'm going to ask you, will you come back on the show? This has been a lot of fun.
I'd love to. No, I had a great time. Yes, please.
You know, I think hearing about the recipes, hearing about this, you know, there's 300,000 foods out there that we could eat, that we're not eating, that we need to explore. Dr. Jacobsohn, anything else first before we let you go?
We've covered a big spectrum, and I really enjoyed talking with you today.
Yeah, let me thank you from my heart, as I've known you for a while. We want to see you be successful. I like this idea of lifestyle modifications. I'm a big fan of that. The idea of sleep and stress and meditation and exercise and doing the things that we need to do, especially during pandemic when we're inside a lot. And so people need to get the things they need to be successful and to be healthy. Dr. Ken Jacobsohn from Medical College of Wisconsin, thank you for coming on Days of Learning podcast today.
Thank you.